Did you know that postpartum depression affects 1 in 7 mothers and can also affect fathers? It's more common than you think. Let's take a moment to understand what postpartum depression really is. It's a severe form of depression that can grip parents after they welcome a new baby. But it's not just limited to the post-birth period. Astonishingly, it can start to show its signs during pregnancy and continue well after delivery. It's a serious condition that can leave parents feeling overwhelmed, while they should be experiencing one of the happiest times of their lives. The key to remember here is that it's not a character flaw or a weakness. It doesn't discriminate, affecting both mothers and fathers alike from all walks of life. So, what are some of the most common symptoms of postpartum depression? Let's find out. Postpartum depression often goes unnoticed because its symptoms can be mistaken for baby blues. However, these symptoms are more intense and longer lasting. So let's delve into the most common symptoms of postpartum depression. First and foremost, mood swings. One might be on cloud 9 one minute and the next feel like they've hit rock bottom. These aren't your average changes in mood. These swings can be severe and unpredictable, causing significant distress. Next up, crying spells. Now, we all have moments when we feel a bit teary, but with postpartum depression, these spells are frequent and may seem to come from out of the blue. You might find yourself crying without any apparent reason, which can feel confusing and overwhelming. Anxiety is another telltale sign. This isn't your everyday worry about the baby's feeding schedule or sleep patterns. This is a constant gnawing anxiety that something terrible is going to happen, a sense of dread that you just can't shake off. Difficulty sleeping is yet another symptom to watch out for. Despite feeling exhausted, those suffering from postpartum depression may struggle to fall asleep or stay asleep. This isn't just about those midnight feedings, it's about lying awake at 3 in the morning even when the baby is sound asleep. Loss of interest in activities that once brought joy is another major red flag. This could be anything from hobbies, social activities, or even time spent with the baby. If you or someone you know is finding it hard to muster enthusiasm for things they used to love, it might be time to seek help. Now, it's important to remember that these symptoms aren't just a 1 or 2 day affair. They persist, often for many months or even longer if left untreated. This duration is what sets postpartum depression apart from the typical baby blues, which usually subside within a few weeks. But there's a silver lining to this cloud. Fathers too can experience postpartum depression, and their symptoms are similar to those experienced by mothers. This means that understanding these symptoms doesn't just help mothers, it can also provide crucial support for fathers struggling with their mental health. As we've seen, these symptoms can be quite severe, but remember, postpartum depression is treatable. With the right help and support, recovery is not just possible, but likely. So don't suffer in silence, reach out and take the first step towards healing. It's not just mothers who can experience postpartum depression, fathers can too. This statement might come as a surprise to many, but it's a crucial aspect to understand and acknowledge. In fact, studies suggest that roughly 1 in 10 new fathers could experience some form of postpartum depression, a reality we often overlook. Like mothers, fathers too are navigating a significant life transition. They're adjusting to new roles, responsibilities, and sleep patterns. This, coupled with the hormonal changes and heightened stress levels, can make fathers susceptible to postpartum depression. The symptoms fathers experience are quite similar to those experienced by mothers. They include mood swings, anxiety, difficulty sleeping, a loss of interest in activities they once enjoyed, and even crying spells. However, the societal expectations and the stereotype of the stoic, unemotional man can make it harder for fathers to express their feelings, making them less likely to seek help. They might feel a sense of guilt or shame, believing they should be strong for their partner and baby, and this can worsen their mental health condition. But remember, it's essential for fathers like mothers to seek help if they're experiencing symptoms of postpartum depression. Postpartum depression is not a sign of weakness. It's a medical condition that requires attention and care. There's no need to suffer in silence or try to tough it out. Early detection and treatment can significantly improve the prognosis and help fathers bond better with their babies. It can also alleviate the burden on their partners, who might be dealing with their own postpartum challenges. Postpartum depression doesn't discriminate. It can affect anyone, regardless of gender. So if you or someone you know is showing signs of postpartum depression, what should you do? The first step is to recognize the symptoms and understand that it's okay to seek help. The next step is to reach out to a healthcare provider who can guide you towards the right treatment options. But we'll delve deeper into that in the next scene. Stay tuned. If you or someone you know is experiencing symptoms of postpartum depression, it's crucial to seek immediate medical help. This is more than just sound advice, it's a lifeline. You see, postpartum depression is not just baby blues, it's a serious mental health condition that requires immediate attention and care. It's not something you can or should try to handle on your own. So, where should you start? Well, the first step is to reach out to your healthcare provider. They are best equipped to diagnose your condition accurately and guide you on the path to recovery. Don't shy away from discussing your feelings and symptoms with them. Remember, they're there to help you. Now let's talk about the various treatment options available. The good news is that postpartum depression is treatable, and there's a range of options to suit different needs and circumstances. Therapy is often the first line of treatment. Cognitive behavioral therapy, or CBT, can help you manage your thoughts and feelings. Interpersonal therapy, or IPT, focuses on your relationships and can help improve your interactions with your baby and others. Then there's medication. Antidepressants can be effective in managing postpartum depression, but it's essential to discuss with your healthcare provider about the risks and benefits, especially if you're breastfeeding. In some cases, hormonal therapy might be an option. As postpartum depression can be linked to a drop in hormones after childbirth, hormone therapy could help balance these levels. And let's not forget about support groups. Connecting with others who are experiencing the same struggles can be incredibly validating and empowering. It can remind you that you're not alone in this journey. In addition to these treatments, self-care plays a vital role in recovery. Eating a healthy diet, getting regular exercise, ensuring plenty of rest, and taking time for yourself can all contribute to your well-being. And remember, treatment is not a one-size-fits-all, it's a personal journey. What works for one person might not work for another. So, it's essential to discuss your options with your healthcare provider and choose a treatment plan that best suits your needs. Lastly, remember that it's okay to ask for help. There's no shame in admitting you're struggling. In fact, it's a sign of strength. It shows that you're taking steps to take care of yourself and your baby. Remember, it's okay to ask for help. You're not alone. Today, we've learned about postpartum depression, its symptoms, and how it can affect both mothers and fathers. We delved into the understanding of this condition, highlighting how it's not just your typical baby blues, but a serious mood disorder that can start during pregnancy and continue after delivery. We've also shed light on its most common symptoms, such as mood swings, crying spells, anxiety, difficulty sleeping, and a loss of interest in activities. Importantly, we've emphasized that postpartum depression isn't exclusive to mothers. Fathers can experience similar symptoms and should not be overlooked. In our discussion about seeking help and treatment options, we've underscored the importance of prompt treatment to manage symptoms and facilitate bonding with the baby. There are a number of easy-handling treatments available, from counseling to medication, all aimed at supporting new parents during this challenging period. Remember, postpartum depression is common and treatable. If you or someone you know is struggling, don't hesitate to reach out for help. Thanks for watching and take care.